just 28 new cases since my update yesterday. That is the first time that the case numbers have been in the 20s since the 24th of June. That is a fantastic outcome and a tribute to the hard work and the sacrifice, the contribution that every single Victorian is making. And I want to say thank you, and I want to say how proud I am and all of us are of the job that's being done in households, in communities, in suburbs, right across Melbourne and indeed in regional Victoria as well. This strategy is working, these numbers are falling, and that's exactly what we have to do. We have to stay the course and get this job done, get these numbers low, because that's when we'll be able to keep them low. If we open up when they're too high, then they will just get higher and higher. That is not only inconvenient, much more than that. It's deeply frustrating, but that's the reality we face, and none of us can deny the reality of those circumstances. But these numbers, the trend is with us, and these are very pleasing numbers today. Obviously, numbers that are not pleasing, they're a terrible tragedy. I have to update that there are now 745 Victorians who have died as a result of this global pandemic. That is 8 more since our last report. 1 female in their 60s, 2 males in their 80s, 2 males and 3 females in their 90s. Six of those 8 deaths are linked to aged care outbreaks, and of course we send our condolences and best wishes to those 8 families. There are just now 97 Victorians in hospital, 12 are in intensive care, and 6 of those 12 are on a ventilator. A total of 2,535,134 test results have been received since the beginning of the year. That's an increase of 14,247 since yesterday. Again, I thank each of those more than 14,000 people who, in the 24 hours before then, went and got tested. Thank you so much for that. It's a really important contribution, but the message again to every single Victorian, regardless of your postcode, your background, your circumstances, doesn't matter. This virus does not discriminate. Everybody's got to play their part. If you've got symptoms, even the mildest of symptoms, please come forward and get tested. Arguably, there's nothing more important than doing that. It gives us the most complete picture. That means we can support you and we can make sure that you're not giving it to anybody else. That's the most important thing that we can do. We'll have more to say about some innovative approaches, some community testing. Alan, I think, if people will give him an opportunity, he will probably speak about the southeast and some pop-up testing, some testing activity that's going on there. But anyone, as soon as you get even the mildest of symptoms, come forward, get tested. You'll get your results within 24 hours, and then you're playing your part in a really powerful way in our collective fight against this virus. There are 4,272 cases with unknown source. That's a decrease of 6 since yesterday's report. 143 healthcare workers who are active cases. We wish them well. We thank them and their colleagues for the amazing work they do across the state every day. The rolling average 3 September to 16 September, Metro 44.4 cases, regional 2.9 cases. That I can also add to that by saying that there are 33 active cases in regional Victoria, so those local government areas that comprise regional Victoria that are now moving into step 3 as of midnight last night. There are only 2 cases that are active in disability facility settings. They are both staff members. So with a really determined and dedicated focus, we have contained some challenges we had there before they became at crisis level. We've been able to drive those numbers down. This is very pleasing given the underlying vulnerability of many people who live in those settings. Aged care shifts, so all the public, all the nurses, all the hospital staff that have gone into aged care, private aged care, some 4,507 shifts, a massive effort. And I thank, on behalf of all Victorians, and particularly on behalf of those who are in residential aged care, I thank those hospital staff for the amazing work that they have done. In terms of aged care outbreaks and active cases, there are 464 active cases in aged care. It's my understanding that they are all in private aged care, and there are a number of outbreaks. The latest outbreak number, I believe, is 75 that are active outbreaks. That is pretty much all the numbers that I needed to take you through. I'm now going to ask the Deputy Premier and Education Minister to speak to a very important and targeted package around early years, so kinder, and also some additional support for vulnerable students. And of course, I should just make the point, the feedback from across regional Victoria in terms of the return to school arrangements, what will essentially be as close to a normal term 4 as possible. It's been very, very clear that parents are particularly excited about that. Just as people across regional Victoria, they've got that hope and optimism, having seen a strategy work to get the numbers down and now to be able to take these safe and steady steps. But I'll just say this to regional Victorians. The rules have changed, but there are still rules. And it's really important that regional Victorians remain vigilant. Just as we are remaining vigilant, the announcements that Victoria Police made yesterday in terms of an almost $5,000 on-the-spot fine, additional cars being pulled over and checked, there's no reason. It is unlawful unless you have a very clear reason to be in regional Victoria. Those reasons are up on the website, they're well known, but we just can't have people taking this virus with them as they unnecessarily and unlawfully travel to regional Victoria. But that's one set of obligations. At the same time, every regional Victorian is obligated, having given so much, having done so much to create this sense of absolute optimism and the opening up, they too need to make sure that they remain vigilant, following different rules, but rules nonetheless.